Mrs. Willing. I'm Donna Myers, and I'm the behavioral health clinician that works with the pulmonologist you saw this morning. I know that he gave you some information regarding the assessment and diagnosis that he's made to date. He has seen you, and he's recommending some medication, and he's also recommending a referral to an allergist.
Correct.
Okay. Tell me a little bit about how you're feeling about the recommendations that he's made so far.
Well, I have reservations about seeing an allergist. But his suggestion is that I do that to try and find out why I'm coughing and why I am uncomfortable. And
Can I give you the explanation he gave me and see if that
Please.
rings for you? He mentioned that you've had bronchitis, chronic bronchitis.
Yes.
You've had a chronic cough. You have actually had pneumonia even
Several
once.
times.
Yeah, recently. And he believes that the cause of all this might be related to allergies. You've never been tested, nor
No.
have you ever been treated
Never.
for allergies, correct?
Correct.
Okay. Is that your understanding as well?
It is.
Okay. Is there any part of that recommendation that you're maybe not so sure about?
I'm just not sure what could happen. You know, if I went, would anything change? If you do all these tests, and I've heard a lot of things about going to an allergist from people. I've never done it myself, so it's only second and third hand information. And I just don't know if I want to delve into that.
I hear what you're saying. I think that basically you don't have a lot of confidence that it's going to give you the answers that
Right.
you're seeking, and you've actually heard from others that maybe it's not the best option. Or
Right.
It wasn't for them.
Right.
Okay. Do you know very much about how the allergist evaluates you?
I don't.
Okay.
Just things I've heard over the years.
Tell me what you've heard. Tell me what
That
you
it's
know.
a series of shots that goes on until they find something or they don't. And things, you have to constantly go to the doctor weekly to determine what it is, and it's a lot of, hassle, waiting around doctor's offices, getting poked with needles.
I think I've heard a couple of things pretty loud and clear. You're a little bit skeptical about the outcomes. You're not necessarily comfortable with what you've heard about the process, with the testing itself and the amount of time it takes,
Mhm.
and the duration and so forth.
Right.
And needles. You weren't comfortable at all with the discussion of the use of needles, whatever that might be.
Right.
Okay. So in the beginning, the only thing that all of this leads to is your decision. Your decision about whether you want to see an allergist, whether you want to have the testing, and then whatever treatment might be recommended. So there's lots of steps here that you are totally given enough information to make your
Right.
own decision. How do you feel about that so far?
Well, I think I've put this off for a long time, and I'm at the end of my rope. So I think perhaps I should get a recommendation for an allergist and make the appointment and get on with it.
And I appreciate where you're coming from. You're a little bit tired of this long and lengthy ordeal, and at least for now, seeing the allergist to be the first step, and you're willing to do that.
I think so.
Okay. We'll talk to your doctor, and we'll get a name of an allergist, or names. There may be more than one. Is there anything you want the pulmonologist to know, anything special, like location or time or anything?
No, I would prefer it not be in another town.
Okay,
that
so
you have to
closer
travel to.
by.
Closer by.
Okay, all right. I'll share that information.
Thank you.
I would like to make myself available to help you through this process, however I might be able to. So when you come in once again to see the pulmonologist, I'll just check in with you if that's okay.
That'd be wonderful.
All right. Thank you.
Okay, thank you very much.